Welcome back to the Noon Show on WBAY TV2, and welcome to Ask the Expert. With a familiar face today, Dr. Kurt from Tower Clock Eye Center is with us. It's great to see you again, Doctor.
Same to you, thank you.
It seems like every time I see you, something has changed. The technology has evolved, and not even just new technologies, but existing technologies continue to get better, continue to improve.
Right.
And we're going to talk about one of those game changers today. It's called iStent. Can you discuss what that is and what that means to one of your patients?
Sure. So iStent, so I'm a glaucoma specialist, and in treating glaucoma, oftentimes we have to learn and adapt to new techniques, which is wonderful for the patients. Good to have treatment options. But iStent is one of those surgeries that's come along recently that we consider minimally invasive glaucoma surgeries. In other words, it's a surgery we can do to help reduce a patient's eye pressure, to help get their glaucoma under control. That is going to be a relatively quick surgery with very fast recovery, really not a lot of downside with some good potential upside.
What is the upside? It's minimally invasive, but the maximum impact is tremendous for folks who truly need it, right?
Right, so when we're treating glaucoma, anytime we can reduce the eye pressure a little bit, over the course of the patient's life, it's going to have a big impact on how they do. So you do a little work up front, that can have a big impact, 10, 20 years down the road and how they're able to preserve their vision. And with iStent, basically it is a stent. It's almost like a heart stent that we can place into the drain inside someone's eye to help open it up a little bit, help that eye drain fluid to help bring the eye pressure down and get their glaucoma under better control. Other
than that long-term impact, as you discussed, what is an immediate impact for the individual who undergoes an iStent?
Well, for the patient, you're not going to feel your eye pressure. You won't feel that it's lower, you won't feel that it's higher, so there isn't really an immediate impact. There isn't an immediate downside either. But we know from longitudinal studies that bringing the eye pressure down 1 or 2 points or more, which is oftentimes the case with iStent, that can help the patient preserve their vision for a longer period of time.
Is that something that has to be repeated down the road, or is this a kind of one-time shot?
Well, currently it's only FDA approved for use with cataract surgery, so it's a one-time shot. We do it with cataract surgery. iStent's been out for about 4 to 6 years now, and there is a newer generation iStent coming out this year where we will be able to implant 2 iStents per surgery. Should help to bring the eye pressure down a little bit more, and they're also looking at approval for a standalone surgery. So in other words, I'd be able to do an iStent surgery without also having to do cataract surgery.
Getting a hold of Dr. Kurt or anyone at Tower Clock Eye Center to find more about iStent or any of their technologies is as easy as following the information right there on your screen. We'll get you back into the Noon Show here on WBAY TV2 right after this.